Child Matters. I'm a mother to a 6-year-old, and when I had Lennon, I was still in school. I went through college with her, going through changes within the Medicaid system, because as a single mother, I wasn't able to work a full-time job and go to college so that I could put insurance on her through myself. And while all that was happening, she was born with a pre-existing condition. She has a heart murmur, and she had problems with her lungs. And because of that, we always had to stay on top of the Medicaid changes. As you may know, we have managed care here, so there's multiple times where my biggest stress was not my exams, it wasn't giving my presentations, it was making sure that my daughter had the health coverage that she needed. And through that, now we also, with the pre-existing condition, there's only one provider in the state that will see her. There's only one pediatric cardiologist, and we are lucky enough to live in Des Moines where that pediatric cardiologist is. But for many kids, that's not a reality. They don't even have that coverage. We're not unlike most families. 49% of Medicaid and Hawkeye enrollees in Iowa are children. So as president, what actions would you take to ensure that all children have health coverage and receive health services that meet their needs?
Yeah. And Emily, the experience that you've had with your child is all too common, right? You know, I think of my youngest is 12. He had a heart attack and he had PPHN, right? You know, I mean, within 24 hours of his birth, he had a heart attack. And ended up life-flighted to Primary Children's Hospital in Salt Lake for the first month of his life. And because we had both the care that we had and quality coverage, you know, now he's a running back on a 7th grade football team. And that's what every parent wants along the way.
Right.
And it's both the physical and the mental health, right? And we should probably touch on some of that as well. Like, we look at, in some ways, the biggest strides for healthcare overall really was, since Medicare was the Affordable Care Act. You know, that's the biggest move we had made in 50 years. And from my perspective, we need to build on that, not start all over, because of things like pre-existing conditions. And we've had Republicans try 70 times now to repeal the ACA. And that impacts every person and every child with pre-existing conditions. But what example? About 90% of people are covered by some sort of health care right now. That doesn't necessarily mean it's quality care. The other 10% we could get if we actually could expand Medicaid to those states that haven't. If we could then auto-enroll people into an exchange, and then I think we have to deal with the overall cost of health care. I'd propose a public option. It's crazy that we pay more for prescription drugs than any country in the world, and we can't even negotiate those prices. And in some of the out-of-network charges, it's surprise medical billing. But to exactly what your point is, and the challenge of a child along the way, I think that there are two different things. One of which is some sort of predictability and certainty in Medicaid, in the Medicaid program. What I've seen in your state relative to my state, where you've privatized Medicaid, it's not the best way to go. Now, the federal government can't set all the parameters for every state, but we know, for like example, in my state, we also cover vision and dental. And few states in expansion population cover dental. Well, if you can't take care of some of these basic needs, you're not going to get everything else along the way. So building and never going to like a block grant for Medicaid, because that requires you to take further and further services away along the way. But providing Medicaid expansion, because it's not only important for the children, it's also important for the communities. When you have 20% of our rural hospitals at risk of closing, as you say, you're lucky because you're expert, you live in Des Moines. But if you lose a hospital in a rural area, you're going to lose that community. And so many of the times it is that base funding issues. We had reauthorized CHIP in 2018. And why it took so long and extensions when we're providing this base health care is beyond me. Like, we need to make sure every child is covered. I think another area that I touch on too, so part of it is making sure that you always have a doctor you can go to. And that's especially difficult in rural areas. So we also have to figure out ways to be providing greater reimbursement areas for our rural areas than even our urban areas. We have to have a quality Medicaid expansion, and I think a public option that you can buy into. But then I'd also say that often we're looking at the physical health and not necessarily all the facets of mental health. And we need to be able to address that from birth on as well. I don't know if you guys have done much work in adverse childhood, the ACEs. Like, we're now rolling out all throughout our first through 5, the PACS Good Behavior game, because building the resiliency, because that's one of these evidence-based programs that have been demonstrated to actually impact the ACEs, the experiences that you have along the way. Long way to say that I think that every child should be covered by health care. And I think that there are real disparities between states. And there ought to be some baseline threshold, but then also we have to make sure that you have a decent provider network and it is affordable.
Thank you.